so wonderful to be together with you. And of course, you've been a hero for us for so long and an inspiration for us for so long. So it's really glorious to be back in Nairobi and a chance to also congratulate you in person, because last year you were nominated for the Nobel Peace Prize.
Yes.
So we didn't get a chance to say congratulations face to face until now.
Thank you.
That is wonderful. What was the background of that?
Well, first of all, thank you very much for coming to Kenya.
We're so excited to be back.
We are always happy to see you because you have been doing so much for Africa, and we appreciate it. We appreciate it very much. Now, the Nobel Peace Prize, as you know, it looks for people who have been promoting health, community well-being. And I was nominated I come from the Friends or the Quaker Church. Mm-hmm. And I was nominated by the American Friends Service Committee and the British Friends.
Wonderful.
What surprised me is the details they gave about my work. I didn't know they were keeping details of my work. Uh-huh. But I was happy that they saw that we were doing something for the people of our communities. Because health tends to be connected only with hospitals. But hospitals is for the sick. To promote health, you have to go to the community. And that is the message that we have been trying to give. Yes.
You got started as a doctor very young, but that must have been very rare for a young woman to go into medicine in Kenya.
Well, actually, my first profession was a school teacher. I actually got a postgraduate diploma. My first degree was in a Quaker college in the U.S. in
Really?
Iowa at William Penn College.
Okay.
And
so you started with the Quakers.
Yes.
Very good. Okay.
And I started as the reason I was so happy the missionary sent me there is because in high school I didn't study any science. We had no science teachers, so the only science we had was biology. And I wanted a health profession. And people told me, well, if you were able to go to the US, you would actually have to start to learn basic science at college level. But it was it was not something I could think about. I didn't even pray about it. But out of the blue, the friends came and told me they wanted to take me to college in the USA, in William Penn College in Iowa. And my first thought was, maybe I'll study science after all.
Wow.
I had never made chemistry. I only knew biology. And so that's the way that God opened the door for me to enter into the scientific field. And when I graduated later, I was actually admitted to a medical school in the US. But after 4 years, I needed to come home. Mm-hmm. My father was elderly, and I was always worried he might die when I'm away. But it was not possible financially to come home. So I had to come home.
What was your father's profession?
My father was a clerk.
A clerk.
He worked as a clerk in the colonial administration. Uh-huh. He was quite good at accounting, keeping accounts, and he also contributed that to the church. He used to be the accountant of the church and so on. So and my mother died when I was in high school. So it was very important for me that my father doesn't die. But it was not possible to come to Kenya before I could go to medical school. And I just couldn't stay away 8 years without seeing my father. So I came home, and then the Ministry of Education said, this is great. We are looking for science teachers. So they took me to Uganda to study postgraduate education.
Wow.
To teach high school. So I was a high school teacher. When I got married, I was teaching high school, biology and chemistry. But then I came to Nairobi when my husband was moved close to Nairobi, and I was sent to one of the schools which were basically a slum at that time, with a lot of sick children in the classroom. So I spent my time, most of the time, taking them to clinics because they were so sick.
What kind
And
of sickness?
malaria, ear thickness, eyes, whether they would be passing their eyes. And so I spent most of my lifetime taking them to the clinics. And then in 1967, the University of Nairobi established a medical school.
Okay.
And Humphreys, who said it as a joke, said, there goes your chance. And it just worked out that...
Was that the first medical school in Kenya?
Yes, that's the first time medical school was opened in Kenya. So I was able to join in 68. By this time, I was already a wife and a mother and so on. But that's how I did medicine.
Were you the only woman in the class?
Pardon?
Were you the only woman in the class?
I was the second African. There were some 5 Asian girls, 3, and we were 2 African girls. A much younger woman who had just finished high school, and myself. In fact, the name they called me during medical school was Granny, because I was a wife and a mother. And my classmates said, "This is your grandmother." I said, "No problem." So I was Granny throughout my training. I always laugh at them because when we meet, we look more or less the same. I said, "I don't mind being Granny." Yeah. So then I finished medical school, and
Wow. What did you do when you finished medical school?
well, I did the usual internship. By the time I finished medical school, by the time I went to medical school, I knew that I wanted to focus on prevention and the promoting of health. So a lot of my clinical specialists wanted me to do this and the other because I enjoyed the whole of medical school. I really enjoyed the studies, and I did well. Actually, I graduated as the best medical student all around. So
Why am I not surprised?
But when I said I wanted to do community health, they said that's a dead end. Why would you want to do community health? It has no international repute. It has no. I told them that is where my heart is. So the problem was that there was nowhere to specialize in community health within East Africa, where you could specialize in everything, obstetrics, gynecology, pediatrics, and so on. But a door opened, and I was invited to go to Hopkins, to the Johns Hopkins University, to do public health. So at least that opened the door into public health. And when I was in public health, my special area during the 1 year of the Master of Public Health was community. My dissertation was on community health.
You invented the field for Africa.
You invented the field.
Well, you know what? I couldn't consult anybody here on that. But fortunately, there was a specialist at Johns Hopkins called Carl Taylor. Carl Taylor had done a lot of community level work in India, what they called it rural health work.
Wow.
So he became my advisor. And so that's how I was able to enter into community health.
Did you know that Sonia's father taught at Hopkins in the School of Hygiene?
Oh, okay.
Probably at the time that you were there. He was there from 1968 onward.
Okay. Yeah. I joined the school in Johns Hopkins, 60 what? I forgot.
Around 1980, I think.
1980. Yeah, he was still there.
So I was able to follow community health, even though
Carl
at
Taylor.
that time community health was not yet a defined field. And because when I was there for the masters, I decided to register for the Doctor of Public Health. And I was asked, "What is your area of specialization?" And I said, "Community health."
What's that?
People's participation in their own health care. And some of my professors were very skeptical about that topic. Who will recognize that topic? I said, I don't want to recognize. I just want to be able to work with people to improve their health, to empower communities to improve their health. Fortunately, my advisor, Carl Taylor, and a few others were keen on it. So that's what I did. I came back to Kenya, established a community health project, and they would come and supervise me in terms of data collection and data management and so on. So I think that I have met very supportive professionals who helped me along the way, and I thank God for that.
The work is incredibly pioneering, very fundamental, but still not everybody's convinced because the government doesn't invest in it.
Well, at least the government of Kenya has begun investing in it. A few years ago when we became devolved, they actually established a community health department for the first time. So we do have now a community
Okay.
health department.
Congratulations.
But the drama in healthcare has been hospitals. The latest hospital approaches, the biggest equipment to do this and the other. But we have been trying to communicate that to prevent disease is more important than to cure it, even for the people's sake. And to promote health, it saves money. To prevent disease saves money. So the government budget could go much further if we spend more money on saving and on promoting, on preventing self and promoting health. So I hope that that message, by the time I'm downstairs, will have gone down that we need to prevent disease and promote health, especially when there are so obvious things that we can prevent.
It's amazing. It saves lives and it saves money.
Yeah?
And we are having a hard time getting it
Yeah.
established around the world.
Yes.
But you found in your work that the communities always want to participate.
Yes, both as the service providers and as the recipients of the kind of care that community health workers can do.
Yes.
It's amazing.
And also community health, even when you provide curative service at the community level, it is more personalized. In many of our health hospitals, many of the hospitals, because they are so pressed with work, and it's like you're in a police station, sit there.
Also, the community health workers know the families that
Yeah.
they're dealing with.
Yes.
So they can understand the circumstances within which these problems arise. They
right.
know that the family doesn't have enough food.
Yeah.
So they're not ignorant of the fact that the child is sick partly because of the food security of the family.
That's
So
it.
they have a much more comprehensive
Yeah.
understanding, comprehensive picture, and they can address it better. A
Yeah.
hospital doesn't know the
And
background.
And the community are very much happier with the community health
Yeah.
workers. They interact with them, they can tell them their difficult stories more easily than telling a stranger in the hospital. So it is easier, because when you're doing community health, you also deal with conflict issues. You deal with, of course, nutrition issues. You deal with food security, and so when I was active in community health, I used to spend quite a bit of time on family conflict resolution, because you can't be healthy if you're fighting all the time.
Yeah.
So it
Well,
opens
you
a
learned
door.
that too.
It opens a door. And I just wish that community health would become a more regular specialization, because it opens the door to the well-being of humanity.
What's the situation with malaria these days in Kenya? Because that's something that we've tried to pay a lot of attention to over the years.
Well, I wish I could say it's no longer a problem, but it is a problem. Malaria is still a problem in the malarious areas, especially in Western Kenya, because as in malaria, the mosquitoes don't live at high altitude. So like Nairobi is in high altitude, so the malaria in Nairobi is very smaller. But if you go to lower altitude like Mombasa and near Lake Victoria in Western Kenya, where the altitude is low, there's a lot of malaria still. And still a lot of, to organize so and that's why community health workers become so important, because they deal with families to tell them the symptoms and signs of malaria. And the treatment of malaria is so simple. If you can just to have the medicine,
Yeah.
you do it and people live. So it's one of those areas that we should not be we should not be losing people to death because of malaria.
And even in terms of prevention, it's the community health worker who can see, as they're visiting the household, whether or not the beds are covered with bed nets or not.
Yes.
So they can intervene at the most earliest level, which is prevention by coverage of the bed nets by malaria, coverage of the bed by malaria bed nets.
Because bed nets are very helpful for preventing malaria, keeping mosquitoes out. But you know, these stories have been around, but I don't know what you do to make them more publicized. I don't know, because it would save a lot of money and a lot of deaths and a lot of illness if we did these basic things.
We remember back in 2006, 17 years ago, when the health minister at the time, Charity Ngilu, said, I'm going to get a free bed net to every person in Kenya.
Yes,
And she did that.
she did that.
And it had a huge effect.
She did that, and I thought it was great. But people said, "Oh, what does a bed net to do with health?" You know, the tendency to dismiss what is practical. I don't know why human beings have that tendency to dismiss what is practical and look for complicated things. Just thinking is still around and she's still strong.
She is still fighting all
Yeah,
the time.
she's still fighting, yes, and we thank God for her life because she has really tried to introduce practical realities into development.
I remember the first time I met her in her office as Minister of Health, and I said, amazing, what a fighter, because everybody was attacking her, but she says, no, we're going to do it. Really, really incredible.
Yeah.
We need the women leaders.
Yes, it would be a great help. It would be a great help to have leaders that can speak what they think should be done, and to have listeners. I also would like African men to pay a little more attention to what women specialists say. They say, here mwanamke, it's just a woman. But whether it's a woman or not, after all, they love their mothers. And their mothers kept them alive. So whether it's a woman or a man, those who keep you alive, we should respect them rather than dismiss them. But many times people dismiss, it's just a woman.
I hope that's changing.
It's changing a bit, but we shall ask the African men.
Okay.
I hope they will respond to this comment.
We'll do our best. They have to know SDG 5, gender equality. That's the
yeah, DG5.
that's for everybody, including for them.
Yes. The Sustainable Development Goals have taken people don't talk much about them. And about the DG5, the gender equality issues, not much. I think they usually, and also the women themselves have been a problem because gender equality for them means being able to fight like the men, to beat the children like the men. So they don't look at the other side, that it is being more supportive of each other. So the message in gender equality should come out more strongly that it is a matter of supporting one another, not being as violent as the other person because now you are equal.
That is so wise, because I've been complaining to Jeff for the last, I don't know how many years, that the few women politicians who make it to the positions of power, they do it by taking on the persona of the men politicians.
Yeah.
So they're often the more hawkish in terms of, aggressive, warlike strategies.
That's the problem. You take out the negative attribute that you don't want. Many people have told me, since you are such an educated woman, why do you behave like a woman? Why don't you hit somebody on the head? But I think that we should encourage the men to become a bit more like women, caring, gentle, and helpful to their families. So I think I haven't yet graduated to the other side to be more like a man, because I have been challenged. Why are you not more like a man? Because that's not my aspiration.
Exactly. Why would I want to do that?
It's more, I would like to feel that I'm more compassionate. Am I getting more compassionate? Am I being more? That's why we still have work to do.
Well, you are inspiring so many people and guiding all of us. I can't tell you how thrilled we are to be together with you.
Well, I grew up in the French church where we emphasize a lot on the people being equal to each other. People being, I mean, my church was the first to have women leaders in the Christian organized community. And because of that, it was sidelined in many organizations because I recognize as women. And for some reason, the people will say things like, God didn't recognize women. He made a man first, but he immediately made a woman. Since he was making two people, he made one and then another. And he said you should be each other's helper. He didn't say you fight. So people like to misinterpret things in their interest. But I think I have been encouraged by many young people that now that I deal with the university, of the university community population more, they seem to be recognizing that it is more important to work together than to fight, or to show that you can beat somebody. Because unfortunately, in the traditional system, it used to be, can you beat her? You don't beat your wife enough. Does she cry? I have been married for 60 years, and I have never been hit. I have never been slapped even. So I thank God for the man that he brought my way. He's out of the town. He's out of Nairobi today. Otherwise, he would have been here. And he said, I greet you. Yes.
As a head of a university that you were, University of Moi University, and now in Nairobi, what is your experience as a female leader in the academia context?
Yes, because in Moi, I was the chancellor, who is an administrator within the university. And I organized meetings with the deans of schools to help them at least to popularize the idea that being supportive, because sometimes a dean can become a policeman. But there are students from difficult situations. Some are orphans, some are this. So we try to open that reality to them to say, please remember that we are dealing with members of our society, and some of them from broken environments. And I think that message began to get across. I think Moi has become quite sensitive to issues of the spread of students who go to at university. The Nairobi University, I became the chair just last year, and we're working on the basic things. For instance, even involving students in discussions of issues, so that the students are aware of the issues that the council is discussing, so that when you make decisions, they know that you are discussing them in their interests. Unfortunately, in Nairobi, the University Academic Staff Union is very active, and they have student issues very much at their heart. Unfortunately, when you look at student issues, the management, sometimes they think you want to disrupt things, or you want to promote rioting, but that would disrupt the students' life. We don't want to promote rioting. We want to promote learning in an environment that supports learning. So that's what we are working on, and most of the members of my council are very much in that line. They want to support learning through respectful treatment and respectful relationships between the academic staff, management, and the management of the university, and between students and the university. So we are working on that.
Yeah, it's wonderful. The human side. The human side.
Well, the human side, yes. What you have been telling us all along, that we must look at the human side in your work. You have really emphasized that. And being in Africa, I must thank you for having emphasized that across continental divides, across racial divides, and encouraging human beings to be human beings to each other, That's all that Sustainable Development Goals
Exactly.
aim at that one. And really, I don't know anyone who has really promoted that more than you. So I thank you so
Pretty
much,
basic.
Professor Sachs, for all the work you've done to promote the well-being of science.
We learn from you,
Ah,
and
no,
you
no.
inspire us, absolutely.
Madam Sachs, thank you for all
Thank
you
you.
have done to promote the human spirit. What is so sad is that the human spirit will help all of us to be in a better position.
Exactly.
All of us to do well, all of us to be better. So I never quite understand why we are against it. But some people are. But I'm sure we shall overcome.
Thank you so
you.
much.